Okay, so to start with, I just wanted to ask, how many of you would define yourselves as being in an intercultural couple, or part of an intercultural couple? Okay, so quite a show of hands. And as we've talked about, this could be a north-south divide, it could be within Europe, these sort of extremes. They don't have to be extremes, but it's more how we define ourselves. And I think that that's one of the things that we're really going to aim to do in this centre, in the spirit of the inclusiveness talked about. It really is going to be a place for anyone who considers themselves an intercultural couple. It doesn't have to be a heterosexual couple at all. We're open to gay and lesbian couples, we're open to different family forms, just anybody who wants help to think about their intercultural differences. And it's going to come with a view of sort of celebrating these differences and finding ways to build bridges across these differences rather than pathologizing these differences at all. So I just wanted to say that to kind of frame what you were saying. But I was thinking when I listened to you speaking, Barry, that when you fall in love with someone from a different culture, you are taking a risk. You do inevitably take a risk, many, many different risks in fact. And one of the risks could be the loss of home. So just connecting to what you were saying, Sunanda, I was just thinking about one of the risks being that you lose the familiarity of the architecture of the landscape, and then you have to recreate it. And actually any home that belongs to an intercultural couple may not be recognizable as home, won't be recognizable as home to either of their families coming from those two different cultures. So I was just going to say as well, that just as London's architecture does not sufficiently reflect multiculturalism, nor does psychotherapy research, theory and practice sufficiently pay attention to religious and cultural and ethnic differences between people and interracial couples. So there's been a lot of research that's come from the US, which is interesting, but not enough that's been done in the UK. And given that the cultural contexts are really different, in the UK until 1967, intercultural interracial couples were illegal, which is quite a frightening thought really, to think it was only in 1967 that they became allowed and legal. Now it's very different in this country, and the whole idea of crossing borders that Killian talks a lot about in his research, when he talks about how in the US intercultural interracial couples cannot even sit in the same carriage in a tube on the underground or in a train because they're so scared that they're going to be lynched by either a black group or a white group, and so they have to pretend not to be a couple. Now it's very different here. The sort of thought about crossing borders has a very different meaning in multicultural London. So even if the architecture doesn't reflect it, the practice does, and that's quite different. And hence, I think it'd be really important to do some research on interracial or intercultural couples that will have very different meaning in this context. And that's what we're planning to do here at the Child and Family Practice in the London Intercultural Couples Centre. We hope to have a research project in partnership with the University of Bergamo, with Valeria, and with the University of East London, Lisa. But we also want to record all our sessions. The Child and Family Practice have very generously given us recording equipment. We're going to record all the sessions with the consent of the couples whom we work with and audit everything. So we have a rich store of material. And one of the thoughts that Janet and I have had is to think about the Exeter model and to see how intercultural couples, the sorts of treatments and interventions, how they're different. And the whole thing about meaning and translating meaning and how that's different in one culture or another. So these are our goals for the future. And this research then is going to lead into our clinical services, and our clinical services are going to lead into research. So it's going to be a recursive process, because we are all systemically trained, so that's what we believe in. And the clinical services, we've got ideas about the kinds of clinical services we have on offer as well. So we're planning therapy, of course, couple therapy, family therapy, and mediation services for couples and families, intercultural couples and families who are struggling. But we also want to have more sort of generic educational and support services, not just therapeutic services. So one of the ideas I had, having attended an all-party parliamentary group on strengthening couple relationships last week, I don't know if anybody else was there. But anyway, I was quite surprised really, because there was very little mention of culture. And I thought, so a lot of it was about premarital, prenuptial therapy. but none of this was sort of designed to think about culture, to think about diversity of any form. No mention of gay and lesbian couples at all in this government initiative. And I thought one of the things we'd really like to offer is groups, premarital, prenuptial groups, just to help intercultural couples to think about what lies ahead, what can be the sort of possible points of conflict, have they thought about having children, what faith will the children be brought up in, etc. So this is one of the plans. We also want to have consultation to professionals. If anyone's stuck with an intercultural couple or family, you're welcome to contact us. Public events, education, public speaking, media consultations. So these are some of the things that we have in mind, and we're going to keep writing to all of you and to keep you involved. And yes, we just want to really create a space where anyone who feels stuck with a dilemma that's of an intercultural nature can come and talk to us, and we can sort of design services that would suit the particular group or the particular dilemmas. Okay, that's all I have to say. Thank you very much. Thank you for being here.